The Mesothelioma Cancer Alliance, MCA, is a non-profit organization dedicated to assisting mesothelioma patients with the financial burden of their disease. As mesothelioma is an aggressive form of cancer caused by exposure to asbestos, treatment can be very expensive and prolonged. The medical costs associated with mesothelioma can quickly become overwhelming for patients and their families. To help alleviate his financial strain, the MCA offers a variety of assistance programs specifically designed to cover expenses related to mesothelioma medical care and support services. All assistance is provided directly to the patient or their representative at no cost. Patients do not need to repay any assistance received through MCA programs. One of the primary types of financial assistance offered is help with medical treatment costs. The mesothelioma treatment process often involves multiple medical visits, chemotherapy or other drug regimens, surgery, and other procedures. These treatments can become very expensive, even for those with health insurance. The MCA can assist with co-pays, deductibles, prescription costs, and other medical expenses not fully covered. This could include costs for CT scans, biopsies, port placements, and all doctor visits and hospital stays related to mesothelioma care. By covering these out-of-pocket treatment costs, the MCA aims to remove financial barriers that may prevent patients from receiving the full care they need. For those facing especially large medical bills or who are uninsured, the MCA may also be able to provide direct grants to pay treatment providers like oncologists, surgeons, hospitals and other facilities. The exact amount awarded depends on the patient's individual financial needs and situation. Grants can go towards paying past due balances and covering the costs of ongoing and future treatments. This ensures patients can continue their prescribed care plans without treatment disruption due to money issues. Even partial coverage of large treatment costs through these direct grants provides much-needed financial relief. In addition to direct medical expenses, the MCA recognizes mesothelioma treatment involves other costs that burden families. This includes travel expenses to frequent doctors' visits at cancer centers sometimes hundreds of miles away. For patients undergoing experimental treatments through clinical trials, travel becomes even more extensive and financially draining. To help lessen these critical non-medical costs, the MCA provides transportation assistance grants. Funds can go towards mileage reimbursement for private vehicles, gas cards, taxi or rideshare services, plane, train tickets, and even hotel accommodations if patients must stay overnight near treatment centers. This allows patients to focus on their health without worrying about how to afford transportation for care. Living expenses are another area where mesothelioma patients struggle, especially those who can no longer work due to illness. The high costs of housing, utilities, groceries and more add tremendous financial stress as medical bills also pile up. The MCA addresses this problem through needs-based living assistance grants. Depending on an individual's resources and responsibilities, these grants may help cover rent, mortgage, food costs, utility bills and other living necessities for a period of time. This funding aims to keep patients and their loved ones economically secure so full attention can be given to the cancer fight without distractions of poverty or housing issues. For many patients, hiring in-home care or assistance is necessary during treatment and recovery. Services like housekeeping, meal preparation, transportation, and personal care help ensure daily living needs are met so patients can focus on regaining health. However, these added care costs place more demands on already overwhelmed finances. MCA support encompasses in-home care assistance through grants to hire needed services. Funds can be used for home health aides, housekeepers, errand runners and prepared meal deliveries. This type of aid significantly lifts the burden of care duties from patients' families and friends as well. It also prevents further health risks or setbacks from fatigue and overexertion trying to manage all tasks while fighting cancer. The emotional and social support needs of mesothelioma patients also warrant consideration. In addition to facing a terminal illness, patients deal with fear, anxiety, depression and other psychological effects of a cancer diagnosis. Support groups and counseling provide valuable mental wellness resources, but these come with costs as well. Through its Counseling and Wellness Assistance Program, the MCA helps cover expenses for support group participation fees, individual or family counseling sessions, stress reduction classes and activities. This funding allows patients the coping assistance and comfort of these valuable services during their difficult journey, free of worrying about how to afford the costs. Staying mentally strong is just as important to recovery as physical treatment, and financial hurdles should not prevent full access to support resources that lift the spirit. When unexpected expenses hit that insurance and personal funds cannot handle, many patients have nowhere else to turn for help. The Emergency Assistance Program through MCA is available for just these situations. Be it an unforeseen medical bill, equipment needs, or costs from non-medical hardships, emergency grants step in during crises. Whether it is a few hundred or few $1,000s required, the MCA reviews applications quickly to address urgent needs immediately. From home repairs after an illness prevents work, to extended hospital stays with exorbitant bills, to paying final medical debts owed, emergency aid plays a vital role in stabilizing mesothelioma patients and their families during surprising monetary setbacks. Through its wide array of customized assistance programs, the Mesothelioma Cancer Alliance aims to eliminate financial obstacles that stand between mesothelioma patients and quality medical care, support services, and overall well-being. By covering treatment costs, travel, housing, care services, counseling, equipment, and unexpected emergencies, the MCA truly takes on the full economic burdens of the disease. This allows full focus on healing and comfort without the relentless stresses inflicted by devastating medical expenses. For patients facing this challenging diagnosis, MCA support offers welcome relief and empowerment to battle their cancer.